Healthcare spending, 1970-2023. Over the last half-century, the relationship between healthcare spending and life expectancy in the United States has been a topic of extensive analysis and debate. While healthcare spending has skyrocketed, the gains in life expectancy have been less pronounced. This article charts the trajectory of healthcare expenditure against life expectancy from 1970 to 2023, probing the intricacies of this complex relationship. The surge in healthcare spending in 1970, the U.S. healthcare expenditure was a mere 6.9% of the gross domestic product, GDP. Fast forward to 2023, and the figure has dramatically increased, hovering around 18% of GDP. This surge is largely attributed to advances in medical technology, increased demand for healthcare services, higher prescription drug prices, and the expanding needs of an aging population. Government programs like Medicare and Medicaid have also contributed significantly to this rise, as have policies that affect healthcare access and pricing. Parallel developments in private healthcare markets have likewise driven spending upward, often due to administrative costs and the complexities of the insurance landscape. Life expectancy, a modest climb amidst these spikes in spending. Life expectancy improvements have been relatively marginal. In 1970, the average life expectancy in the U.S. was about 70 years. As of 2023, this figure stands around 77 years. While this is progress, the rate of increase has not kept pace with the growth in healthcare expenditure. Compared to other developed nations, where both life expectancy and healthcare spending patterns have been more aligned, the U.S. remains an outlier. Factors influencing discrepancy. Several factors contribute to the discrepancy between healthcare spending and life expectancy gains in the U.S. Inequalities in access to healthcare. Socioeconomic disparities often result in unequal access to healthcare services, affecting marginalized communities' life expectancies. Lifestyle and chronic diseases. High rates of obesity, diabetes, and heart diseases prevalent in the U.S. substantially impact life expectancy. Lifestyle choices such as diet, exercise, smoking, and alcohol consumption play a critical role as well. Healthcare system inefficiencies. Despite high spending, the U.S. healthcare system struggles with inefficiencies, including administrative overheads and fragmented care delivery, which hinder optimal health outcomes. Preventive versus reactive care. The U.S. healthcare system often emphasizes treatment over prevention, potentially reducing the effectiveness of spending in prolonging life expectancy. The road ahead. Efforts to reconcile healthcare spending with life expectancy outcomes in the U.S. require a multifaceted approach. Enhancing access to healthcare, addressing lifestyle factors, streamlining healthcare systems, and investing in preventive care are pivotal. Additionally, harnessing technology and data analytics can improve patient care, reduce costs, and ultimately pave the way for innovative healthcare solutions. Policymakers must also address the underlying social determinants of health to bridge the gap between investment and outcomes. Conclusion. The charting of healthcare spending against life expectancy in the U.S. from 1970 to 2023 reveals a complex and evolving landscape. While spending has increased dramatically, life expectancy gains have been modest, underscoring the need for systemic reforms. As the nation grapples with these challenges, the pursuit of a more efficient, equitable, and effective healthcare system remains paramount.